Hello everybody. Today we'll talk about the endocrine system. You know that two systems among the 11 systems of your body belong to the control systems. So endocrine system is one of those two control systems of the body. First we'll talk about the properties of the endocrine system. Then we'll talk about the important endocrine glands of the body. Then we'll talk about a brain structure that is called the hypothalamus. Hypothalamus is considered as an endocrine gland. So hypothalamus, it is a brain structure, but it is also considered as an endocrine gland. And hypothalamus secretes some factors called the releasing factors that regulates the functions of the pituitary gland. And pituitary gland is also located inside the brain, and it is known as the master gland. You probably already know that pituitary is called the master gland of the body. Why? Because this gland regulates the other endocrine glands of the body. Okay, so in the brain you have the hypothalamus and the pituitary gland. Hypothalamus is located just above the pituitary gland. So if you see inside the brain, this is the pituitary gland, okay, and it has two lobes. So this is pituitary and this is hypothalamus. Okay, and you see they are very close to each other, and hypothalamus is sitting just above the pituitary gland, and hypothalamus regulates the pituitary gland, and pituitary gland regulates the other glands of the body, other endocrine glands of the body. Okay, so hypothalamus is the boss of the pituitary gland. It regulates the secretion of the pituitary gland, anterior pituitary and posterior pituitary. Okay, and then pituitary by its secretion regulates the other endocrine glands of the body. Okay, that's why pituitary is the master. However, hypothalamus is the master of the master. So we'll see the anterior and posterior pituitary hormones. There are 6 hormones released from the anterior pituitary and only 2 hormones from the posterior pituitary. We'll see what are those hormones and what they do. Then we'll talk about the regulation of endocrine secretion and important endocrine glands and their hormones in the body. Okay, so those are the things we'll talk. So the endocrine system consists of the endocrine glands, and if you see an endocrine gland, so this is the gland, okay, and these are the cells inside the gland, and these cells secrete the hormone. Okay, so this is endocrine gland. This is an endocrine gland, and these are the cells of the endocrine gland. And now if you see how the hormone is secreted. This is the blood capillary. You know, blood capillary is everywhere in the tissue, right? So inside the endocrine gland, you also have the blood capillary. Okay, so what happens in case of endocrine glands? These cells secrete the hormone where in the interstitial space, that means in the fluid in between the cells. Okay, so this is the interstitial space where you have the fluid. So the cells first secrete the hormone in the interstitial fluid, and from that fluid the hormone molecules enter into the blood of the capillary. Enters into the capillary blood. Okay, so now the hormone molecules are inside the blood capillary, right? So then the blood vessel will take the hormone out. Now once the hormone is out from the gland, since the blood flows everywhere throughout the body, right? So the hormone will go everywhere, will go circulate throughout the body. So the action of the hormone could be generalized, widespread, not localized, because the blood circulates everywhere, right? So the hormone may act on different targets in the body. So makes sense. So the blood will take the hormone to the body, and the hormone may act or work on a number of structures. Okay, so that is called generalized action. Okay, and the target could be far from the gland, because if the gland is in your brain, once the hormone is released into the blood, that blood can take the hormone to the kidney or to the liver or to the muscle or to the bone, so far away from the gland. So in case of uh, endocrine, the target is far from the gland. Okay, so those are few important things about the endocrine system or endocrine gland. Now if you see the exocrine, so we'll now see the exocrine system. This is an exocrine gland. Okay, so exocrine gland, and these are the cells inside the gland. And what happens, uh, instead of the capillaries inside the exocrine glands, the chemicals are directly released into the ducts. Ducts are tube-like structures. Okay, so not the blood vessel, duct. Okay, So what happens? The small ducts join to the large ducts. Okay, so these are small ducts or small tubes. Okay, so what happens? You see, the chemical is directly secreted from the cells into the duct. So these small ducts will get the chemical directly from the cell, and then small ducts will give the chemical to the larger ducts and further larger, and the largest duct will take the hormone just to the outside of the gland and release, because the duct ends here, okay, just outside of the gland. So the hormones or chemicals will be released just outside of the gland and will act here. Since it does not enter into the blood, it does not circulate throughout the body. It will act locally just outside of the gland. So localized action. Makes sense? Where? Just around the gland. Just around the gland. Just outside of the gland. Okay. So you see that in case of exocrine, the action is localized just around the gland or outside of the gland. In case of endocrine, the action is generalized, widespread. In case of exocrine, the action is near the gland. In case of endocrine, the action is usually far from the gland. Okay, and in case of exocrine, the chemicals are secreted into the ducts directly from the cells. In case of endocrine, the chemicals or hormones molecules are first released in the interstitial fluid, and from there they enter into the blood capillary. Okay, so if I ask you to describe the differences between the endocrine and exocrine systems, you will mention these important things. Okay, now there are several endocrine glands throughout the body. These are the important endocrine glands of your body. So what are the important endocrine glands of the body? If you start from the brain, inside the brain you have the master gland, pituitary. Okay, I would also include here hypothalamus that I mentioned at the very beginning of my lecture. Thalamus, okay, which controls the pituitary, and then pituitary controls the other endocrine glands of your body. Okay, that's why pituitary is called the master gland. Then inside the brain you have another tiny glands. Those are called the pineal glands. And then if you go down, in front of the lower part of your neck you have the thyroid gland. Okay, then in the back of the thyroid gland you have the parathyroid glands, 4 to 8 in number. The number is not fixed, but it could be between 4 to 8 tiny glands are attached to the back of the thyroid. If you see a thyroid gland looks like a butterfly, like this. Okay, so this is a thyroid gland, uh, and it has two lateral lobes. Lateral lobes. This is one, this is another, and they are connected by an isthmus. Okay, so that's the thyroid gland located in the front of the lower part of the neck. Now, if you see the back of the thyroid gland, not the front, tiny glands, 4 to 8 in number, are attached to the dorsal surface of the lobes of the thyroid, and these are the parathyroid glands. Okay, then another gland that is called the pancreatic islets in the pancreas. So pancreas is the gland actually. Pancreas is the gland. However, the endocrine part, since we are talking about the endocrine gland, pancreas has both endocrine and exocrine. So pancreas is a mixed gland, not purely endocrine. Okay, other glands I'm talking here are purely endocrine. However, pancreas is a mixed type gland. That means it has both endocrine and exocrine parts. So exocrine, it has exocrine gland as well as endocrine gland inside. That's why it is called a mixed. The endocrine part of the pancreas is pancreatic islets. Okay, and then on the top of the kidneys you have the adrenal glands. So this is the kidney, and the adrenal gland is sitting on the upper pole of the kidney like this. It is like a crown of the kidney, and that's why it is also called suprarenal gland. Supra means above, renal means kidney. So adrenal glands are also called suprarenal glands. You have two kidneys and you have two adrenal or suprarenal glands. Very important gland. Okay. Then the gonads. In case of male, the male gonads are two testes. In female, the female gonads are two ovaries. Okay. Now I'll quickly go over again. The pituitary is called the master gland. It controls the other glands of the body, and hypothalamus regulates the pituitary secretion. Pineal gland. Pineal glands are responsible for two important functions. One is called circadian rhythm. Circadian rhythms are day-night cycles in your body, or sleep awakeness cycle. Okay, so that is controlled by the pineal gland. Another function is synthesis of or production of a chemical that is called melatonin. Probably some of you have heard. You can buy it over the counter uh, for sleep. So melatonin is the chemical synthesized in the pituitary glands, and it induces sleep. So those are two important functions of the pineal glands located inside the brain. Then thyroid, butterfly shaped, located in the front of the lower part of the neck. It has two lateral lobes, right, connected by an isthmus, and the main function of thyroid is metabolism. Thyroid hormones increase metabolism or metabolic activities of the body. Okay. Another important function of thyroid is lowering calcium in the blood. lowering the calcium in the blood. Okay, so these are two important functions of thyroid. Then parathyroid are attached to the dorsal surface of the thyroid, 4 to 8 in number, and parathyroid glands do what? Increase calcium or elevates calcium uh, in the blood. So you see one thing here, that thyroid hormones lower uh, uh, thyroid hormone lowers calcium, and parathyroid increases calcium, blood calcium. So opposite action of those two hormones. Okay. Uh, then pancreatic islet is the endocrine part of the pancreas, and pancreatic islet produces two hormones, insulin and glucagon. Okay. Insulin elevates or increases the blood glucose or sugar, and sorry, insulin lowers the, all of you know that insulin lowers the blood glucose. That's why diabetic patients take the insulin. So insulin lowers or decreases the blood glucose, and glucagon, just opposite action of insulin, it increases the blood sugar or glucose. Okay, so by the action of these two, your blood sugar is maintained. Make sense? So when you eat a lot of food, your blood sugar tends to go up, right? So the insulin will be released more to decrease the blood sugar. uh, if you are starving, you are not getting food from outside, not taking food from outside, what will happen? The blood sugar will go down. In that case, the glucose will be released from the pancreatic islets. Okay. Adrenal gland. This one is a very important gland, as I mentioned, has a number of functions. Glucose production, number two, regulation of minerals, sodium, potassium, calcium, those are the minerals. Okay, so regulation of minerals. Number three, strong anti-inflammatory action. Strong anti-inflammation, anti-inflammatory action heals the inflammation. Okay, production of sex hormones. Small amount of sex hormones uh, is produced by the adrenal gland. So and production of adrenaline, a very important chemical released in the body when you are excited. So you see, the adrenal glands perform a number of very important functions. Okay, synthesis of glucose, regulation of minerals, anti-inflammatory action, sex hormone synthesis or production, and production of adrenaline. Then the gonads, if you go further down, gonads, male gonads are testes located inside the scrotum, and female gonads are ovaries located in the pelvic cavity. And gonads produce sex hormones. Okay, sex hormones. So those are the important endocrine glands of the body. and you see their locations here in the brain. You have the hypothalamus, pituitary, pineal, right? These are inside the brain. Then the front of the lower part of the neck, thyroid, and in the back of the thyroid you have parathyroid. And this is another endocrine gland we didn't mention in last slide, located in the upper part of the thorax, that is called the thymus. This gland, just know that, is heavily responsible for immunity in the early part of your life. In the latter part of your life, this gland becomes less important, almost no significance. That's why it shrinks a lot. In early part of your life, if you see an infant or a baby, the thymus is so big that it occupies almost the whole upper part of the chest. Then it shrinks gradually and becomes very small at puberty and stays small like that. Why in infants, or in very early part of your life, the thymus is so large? Because uh, in the body of an infant, the immune functions are not yet developed, not yet established at that time. So the thymus works a lot, must work a lot to maintain the immunity. Then as the other immune systems develop in the body, the function of thymus gradually decreases. So the size also gets smaller, okay, in adults. So thymus is responsible for immunity. Then you see on the upper pole of the kidney, you have the adrenal glands, pancreas in the abdomen. Pancreas is located horizontally, you see, like this, and it has a head part, head. This is the body of the pancreas, and this is called the tail of the pancreas. Okay, so it has three parts, and inside the pancreas you have both endocrine and exocrine parts. Endocrine part is called the pancreatic islets. We talked about that. Then ovaries in the pelvic cavity in female, and testes inside the scrotum. Those are the gonads. So hypothalamus is very closely uh, linked with the pituitary gland. As I mentioned, sits just above the pituitary gland and controls the pituitary secretion. Okay, so the pituitary gland, as I mentioned, has two lobes, right? So this is the hypothalamus, okay, and this is the pituitary, and pituitary has two lobes. So this is hypothalamus, and this lobe, if this is front, this lobe is called anterior pituitary. Anterior pituitary. This is called posterior pituitary. Anterior pituitary is also called adeno. Adeno means gland. Hypophysis means pituitary. Hypophysis. So anterior pituitary is also called adenohypophysis. Okay. Adeno means gland, and hypophysis is another name of pituitary. You remember hypophyseal fossa in the sphenoid bone for the pituitary gland. So hypophysis is another name of pituitary. Posterior pituitary is also called neurohypophysis. hypophysis. That means neural part of pituitary gland. And anterior is the glandular part, adeno means gland, of the pituitary gland. That means anterior pituitary has the cells like glands, glandular cells or gland-like cells. Okay, gland-like cells. And posterior pituitary has the cells like neuron, neuron, nerve cells. So neuron-like cells. That's why called neurohypophysis. Okay, gland-like cells and neuron-like cells, adenohypophysis, neurohypophysis. Now, I told you that hypothalamus always talks to the pituitary, both anterior and posterior pituitary. So, how the hypothalamus talks to the pituitary gland? Hypothalamus talks to the anterior pituitary and posterior pituitary in two different ways. These are the neurons of the hypothalamus, okay, and this is the capillary bed in the hypothalamus. You know that blood capillaries form the bed, so this is the capillary bed, and then this is an arterial, small artery, and that is called portal artery, and this is another capillary bed here in the anterior pituitary. So you see here, this is one capillary bed in the hypothalamus, and this is another capillary bed in the anterior pituitary. Make sense? So two capillary beds are connected by this artery. That's why this is called portal. When in your body only few places you have the portal circulation, where two sets of capillaries are connected by a blood vessel, that is called portal blood vessel. Okay, so this is one case where you see two capillary beds are connected. So this is called name is long but very easy, hypophyseal portal system. Hypophyseal portal system. Why hypothalamo-hypophyseal? Because this is hypothalamus and this is hypophysis pituitary, and this portal vessel is connecting them. That's why it is called hypothalamo-hypophyseal portal system. Okay, so what happens here is, see, these hypothalamic neurons will secrete the factors, chemicals called the factors, chemical factors. Okay, and those chemical factors will enter into the blood capillary, and then the blood will bring the factors down to the anterior pituitary. Makes sense? And these factors will stimulate the anterior pituitary to release the anterior pituitary hormones. Okay, so the blood is bringing signal from the hypothalamus to the anterior pituitary. And there are 6 hormones in the anterior pituitary I mentioned before. Now let's see how hypothalamus talks to the posterior pituitary. In the hypothalamus, you see, these are the neurons, and these neurons have long axons, okay, and these axons go all the way down to the posterior pituitary. So the axons of these long axons of these neurons go all the way down to the posterior pituitary gland, okay, and the bundle of these axons is called tract. You know, bundle of axons or fibers is called a tract. You already know that from the spinal cord. So this is a tract, okay, hypothalamo-hypophyseal tract. So not by the blood or not by the blood vessel. So what happens, from the axon terminal here, the chemicals are released into the posterior pituitary, and 2 hormones are released from the posterior pituitary. We'll talk about that. So anterior pituitary and posterior pituitary both are controlled by the hypothalamus, but hypothalamus talks to them in 2 different ways, okay. Anterior pituitary by the portal system, by the blood; posterior pituitary by the tracts or nerve fibers. Okay, so now what are those 6 hormones released from the anterior pituitary? Growth hormone or GH, thyroid stimulating hormone TSH, also called thyrotropin, adrenocorticotropic hormone ACTH, follicle stimulating hormone FSH, luteinizing hormone LH, and prolactin. Okay, you need to remember all these names. Now growth hormone, probably you have already heard. This hormone is used in the farms to grow the animals first, right? To increase the production of milk, or to grow the uh, fishes or other veg. So growth hormone has widespread use in our society. So growth hormone is one. Then thyroid stimulating hormone. Just think, its name is telling you it stimulates the thyroid gland. So it will go to the thyroid gland, right? From the pituitary, it will go to the thyroid gland to stimulate the thyroid gland to release the thyroid hormone. Adrenocorticotropic hormone. Adrenal gland, right? Sitting on the kidney, you remember? And adrenal gland has 2 parts. We'll talk about that. Outer part is called the cortex, and inner part is called the medulla. Okay, and this is the kidney, upper pole of the kidney, right? So anyway, so outer part, this is the cortical part or cortex. So this hormone works on which part? Cortex part. That's why it is called cortical. Adrenocorticotropic hormone. Okay, not on the medulla. Follicle stimulating hormone and luteinizing hormone, these 2 hormones work on the gonads, testes and ovaries, and help in the growth of the sperm and ovum, as well as the release of the ovum, called ovulation. So growth of the sperm and ovum and maturation of the ovum and sperm, as well as the ovulation. Okay, particularly the luteinizing hormone causes the ovulation, release of the egg from the ovary. Okay, prolactin, this hormone helps in the production of milk, synthesis of milk in the mammary gland, okay, in pregnant mom. So production of milk, which is called lactation. Okay, production of milk, prolactin. So those are the 6 anterior-pituitary hormones. Okay, and posterior pituitary only has 2, oxytocin and antidiuretic hormone, or ADH. Oxytocin is a very important hormone. It performs a couple of very important functions. One is uterine contraction. During the birth, childbirth or labor, uterus contracts. That contraction of uterus is caused by oxytocin. So it helps in childbirth by uterine contraction. Another function is ejection. Ejection of milk from the mother's breast or mammary gland. Ejection of milk. Now you see here, the production of milk in the mammary gland is the function of anterior pituitary hormone prolactin, but after the production, that milk must be ejected, get out from the mammary gland or breast. So that ejection function is given by the oxytocin. So 2 different things, right? So when the baby sucks the mother's breast, then the secretion of oxytocin increases, and that will eject the milk out from the mammary gland or breast. Antidiuretic hormone, its name is telling you its action. Anti means opposite, against, and diuresis means urination. So decreases urine production. Make sense? Anti-diuretic hormone. Okay. Diuretics do what? Diuretics produce more urine. Common diuretics: caffeine, coffee, alcohol, right? And the medicines, furosemide, Lasix, they produce a lot of urine. They are called what? Diuretics. Diuretics. Diuretics do what? Produce more urine. Antidiuretic hormone will do opposite. Okay, it is decreasing the production of urine. That means the volume of urine will be less. If more ADH, less urine production. Okay. Okay, now we'll talk about the growth hormone. The first one, anterior-pituitary hormone, growth hormone. Its action is very generalized, widespread. Widespread action means growth hormone works on almost all types of tissues. All types of tissues. However, its action is more on 2 types of tissues: bones and skeletal muscle. Skeletal muscle. On these 2 structures, the action of growth hormone is more prominent. However, it has action on almost all the tissues of the body. And growth hormone, its name is telling you, helps to grow the body or grow the tissue. And if the growth hormone secretion is more than normal during the growth of your body, that means before puberty, during or before puberty, not after puberty. If the growth hormone secretion is more uh, during the growth of the body, then what will happen? The body will grow more than normal, and that will cause what? Gigantism. So increase growth hormone secretion before or during puberty will cause what? During or before puberty. More growth hormone secretion when the body is growing, that means the body will grow fast, and that will increase the growth of the body very fast, and that will cause what? The person will become bigger than average people. So that is called giantism, also called gigantism. Okay, giantism or gigantism, same thing. Okay, the person will be much bigger in size. This is a person has giantism, and this is normal average person, so you can see the difference. Okay. By the way, this is a picture from St. Louis, East St. Louis, very famous picture used in many textbooks worldwide. This person died, and you can go and see his grave. Okay, so St. Louis is famous. Okay, so now let's see. If the growth hormone secretion is less than normal, then the person's body will not grow like normal, will grow less than normal, and that will cause what? Dwarfism. Makes sense? Dwarfism. The person will be short, small. Okay. Now you understand that normal growth hormone secretion is very important for the normal growth of the body. Okay. So during the growth of the body, your body needs normal amount of growth hormone secretion from the anterior pituitary gland. Too much is not good, too small is not good. Now, the giantism or gigantism person, the lifespan is short. Lifespan is what? Short. Shorter than normal average people. Why? Don't think that big body size means healthy. As I told you, that growth hormone works on the most of the tissues of your body. So it will work on the cardiac muscle, will make the heart big, right? Will work on the liver and other organs, will make them big. Big is not good, small is not good. Normal size is required for the normal function of the body. Okay. And almost all cases of giantism, we see the patient gets diabetes mellitus, so suffer from diabetes. Okay, now why the lifespan is short? Now you can understand that the person, giantism person, gets diabetes very early part of the life, and that is one reason of short lifespan. and hypersecretion of growth hormone will cause this, and hyposecretion will cause this. Now, if growth hormone secretion was normal during the growth of the body, but in adults, if the growth hormone secretion increases, that will cause acromegaly. So in adult, after the growth is completed, if suddenly your anterior pituitary secretes more growth hormone, then what will happen? The bones of your finger bones will get thick and wide. Facial bones will get thick and wide. Okay, and the tongue will also get thick. Tongue will get thicker. So the person, when he will talk, it will be sluggish. Okay, the speech. So you see, this is an acromegaly patient or person. You see the facial bones got thick, so you see the protruded mandible, the face is big, and also the finger bones are thick, so the fingers are thick, and that is the acromegaly that happens due to increased secretion of growth hormone after the growth is completed in adults. Because in adults the bones already the ossification is completed, right? So the bone formation is completed, so the bones cannot grow in length anymore. However, certain bones will grow in weight. uh, the secretion of the endocrine hormones is mainly controlled by the negative feedback mechanism. So negative feedback, you remember positive and negative feedback. So and negative feedback is used more in the body than positive. Why hormonal secretion is regulated by negative feedback? We know that hypothalamus releases the releasing factors. For example, hypothalamus has released thyroid releasing hormone or factor, and that will go to the anterior pituitary. Anterior pituitary will release thyroid stimulating hormone, and that thyroid stimulating hormone will stimulate the thyroid gland. Thyroid gland will release thyroid hormones. Make sense? So in the blood, the concentration of hormone will gradually increase. Okay, so more and more signal will come from the hypothalamus downwards. The amount of secretion from the thyroid will go up and up, and when it will reach to a certain limit, the upper limit, then what will happen? Inhibitory signal shown by the broken lines here will go to the anterior pituitary as well as to the hypothalamus, and will tell those top two regulatory structures to stop sending signal to the thyroid gland. So thyroid gland will not get any more signal, and the hormone level will not go up anymore. So the hormone will work on the tissue, and then when the hormone concentration in the blood will go down again, then again the hypothalamus will be activated. Okay, so that's why we say that the hormonal endocrine secretion is regulated by the negative feedback mechanism mainly. So we already talked about the prolactin, talked about the oxytocin, two important functions, antidiuretic hormone. Now, the antidiuretic hormone must work on the kidneys because it decreases the production of what? The urine. So to decrease the production of urine, it must work on what? The kidney tubules. Inside the kidney you have the nephrons. You must remember the nephrons. And the last part of the nephron enters into the collecting duct. So this is the collecting duct. You will learn more in NP2. Just know that inside the kidney you have nephron. Okay, million of nephron. Those are very tiny. And antidiuretic hormone works on the collecting duct of the nephron. And it does what? You see here, anything inside the collecting duct will become urine. Okay, will get out from the body as urine. Inside the kidney, urine is produced in the kidney. So antidiuretic hormone works on this part, collecting duct of the nephron, and does what? Takes the water back into the body. So water returns to the body by the action of antidiuretic hormone. Makes sense? So it comes from where? Posterior pituitary, all the way from the up from the brain, pituitary, and blood takes it to the kidney, and it works on the kidneys and takes the water back into the body. So what will happen if the water is taken back into the body? Urine will be less. Makes sense? So that is the action of antidiuretic hormone. Now, posterior pituitary tumor. Tumor in the posterior pituitary may destroy the posterior pituitary gland, and in that case ADH will not be secreted and water will not be taken back into the body. So water will remain in the collecting duct and will get out as urine. So the volume of urine will be high. So normally antidiuretic hormone takes some water back into the body. That's why we produce concentrated urine. However, if no antidiuretic hormone or very little antidiuretic hormone due to posterior pituitary tumor, then what will happen? A lot of water will remain in the collecting duct and will get out from the body. So the volume of urine will be much higher than normal. Okay, and that is called diabetes insipidus. Diabetes insipidus, okay, is a clinical condition which is not related to insulin. This diabetes is not related to insulin. Diabetes mellitus is related to insulin. So this diabetes is called diabetes insipidus. It is related to antidiuretic hormone, posterior pituitary tumor, and increased production of urine. So the person will frequently go to the bathroom, will produce a lot of urine. Dehydration will quickly occur in the body. Okay. Thyroid gland, as I mentioned, that there are two lobes in the thyroid gland connected by an isthmus, and thyroid hormones increase metabolic activities and lowers the calcium. So how many hormones secreted from the thyroid gland? Three. One is called T3, another T4, and another is the calcitonin. T3 and T4, they increase metabolism in the body. Okay, so T3 and T4 are responsible for metabolic activities. So T3 is also called tri. It's wrong here. Just correct it. Triiodothyronine. Thyronin. Tri means three, right? So three. And T4 is called tetraiodothyronine or thyroxine. Same thing. Okay. Tetra means four. So tetraiodothyronine or thyroxine. Now why T3 and T4? In triiodothyronine you have 3 iodine or iodine atoms. 3 iodine atoms in one molecule of hormone. In tetra or T4 you have 4 iodine atoms. Okay, so now you know that iodine atom is very important for the production of the thyroid hormones T3 and T4. They are essential. So iodine atoms bind with a amino acid that is called tyrosine. So what happens? Uh, two tyrosine molecules bind with the iodine atoms to produce T3 or T4. So amino acid tyrosine and iodine atom both are important or essential for the synthesis of T3 and T4. Calcitonin lowers the blood calcium. So if blood calcium tends to go up, that is called hypercalcemia. In that case, the calcitonin will be released from the thyroid gland. Okay. Here you see the thyroid gland, 2 lateral lobes connected by isthmus. Okay, looks like a butterfly. Now, inside the thyroid gland, you have many follicles. What are the follicles? If you see inside the thyroid gland, you have columnar structures, like finger-like structures. Of course, not that big. So these are called what? The follicles. So thyroid lobes are heavily filled with follicles. So inside the thyroid, you have these follicles. Okay, and in the wall of the follicles, you have the follicular cells. Makes sense? So in the wall of the follicles, you have what? The follicular cells. So these are the follicular cells. Okay, and in between the follicles, you have another type of cells. They are located in between the follicles, the space in between the follicles. These are called parafollicular cells. So you see here, now if I make a cross section, like cut like this, make a cross section and see under the microscope, what you will see? You will see many round. Each follicle is like a round structure, right? Like this. So you will see the follicles are like this, like this. These are the follicles, and in the wall, these are the follicular cells. Makes sense? And in between the follicles, so these are follicular cells, and in between you have the parafollicular cells. These are parafollicular cells. Now let's see here. You see the follicles in the picture here, and the follicle cells or follicular cells in the wall of the follicle, and parafollicular cells in between. And follicular cells or follicle cells produce T3 and T4, and parafollicular cells produce calcitonin. So those are three hormones of thyroid, right? Calcitonin. Now, inside the follicle, what do you have? Inside the follicle here, you have protein called colloid. Okay, jelly-like, jelly-like thick fluid, a protein that is called colloid. So you see colloid filled follicles. So here you have colloid, and in this protein the amino acid tyrosine that I mentioned just a few minutes ago, right? So the tyrosine is present in this protein because you know that amino acid makes the protein. Okay, so the tyrosine, when you eat the iodine with your food, that iodine atoms will bind with tyrosine, amino acid tyrosine, to produce T3 and T4. Okay, so here you see 2 tyrosine, 4 iodine atom will produce T4. 2 tyrosine, 3 iodine atom will produce T3. So these are 2 hormones increase the metabolic activities, and that colloid protein is also called thyroglobin. Okay, globin in the thyroid protein, colloid, and it contains the tyrosine. Okay, now the term hyperthyroidism, I'm sure if you many of you have heard this term hyperthyroidism, very commonly used. That means the hyperfunction of the thyroid gland. Okay, if the thyroid gland activity increases, then what will happen? The metabolism will increase. Okay, so in hyperthyroidism we see increased metabolism in the body. Okay, so when metabolism in your body increases, then what kind of changes you see in the body? You all know. When metabolism increases, example, when you do exercise, right? So in hyperthyroidism, even if you are not doing exercise, you are sitting in resting condition, since the thyroid hormone is being released more, metabolism increases, right? So the person will have increased heart rate. Okay, increased heart rate. You know, when metabolism increases, heart rate increases. Increased blood pressure, increased heat. That means the body will be warm. Increase body heat. So if you touch the person's body, you will always feel like warm body. uh, and if it continues, if you don't get the treatment, like if it continues, then what will happen? If the metabolism is always high in your body, the body, for metabolism you need, the supply of fat. When metabolism increases, the body uses the stored fat, so the person will lose the body weight. So decreased body weight, the person will be skinny, no fat. Okay, and also the person will have sleeplessness. The person will sleep less, will have difficulty in sleeping, and the person will be irritated easily, okay, because of sleeplessness and increased heat and other factors, increased heart rate. So the person will always feel like palpitation, increased, the blood pressure. Those are the symptoms of hyperthyroidism. Makes sense, right? Because T3 and T4 increase the metabolism. Hyposecretion is called hypothyroidism. Hypo, less. So in that case, T3 and T4 is less than normal. So the person will, have low blood pressure, low heart rate. The body will be cold, chill. If you touch the body, it's cold. Uh, okay, fat will accumulate in different areas. Uh, so the person will be sluggish, slow. Uh, so those are the symptoms of hypothyroidism. Now, if you don't treat the hyperthyroidism or hypothyroidism, that may lead to few clinical conditions. Prolonged hyperthyroidism or hypersecretion of thyroid will lead to a disease that is called the Graves' disease. So hyperthyroidism may lead to Graves' disease. In Graves' disease, you will see the signs of hyperthyroidism. That means the person's heart rate, blood pressure will be high, right? The body will produce more heat, okay, and other complications. This is pretty common. The person's eye looks like, coming out from the uh, uh, orbital fossa. That means the protruded eye we see. So you see here, this is a picture of a patient of Graves' disease. You see if you look at the eyes, looks like the eyes are being pushed outwards. Okay, and this is the one of the most common forms of hyperthyroidism, and this is an autoimmune disease. Now we know that the immunity, your own immune system creates antibodies against the thyroid gland, and that will increase the activity of the thyroid gland. Okay, so antibodies that are produced will create too much thyroid hormone. Anyway, so these are the signs of or symptoms of Graves' disease. Let me write it down here. The person's weight loss, okay, increased heart rate, which is called tachycardia. So all these symptoms will be there, or some of those at least. Okay, the person will be irritated easily, irritability, uh, and another thing that might happen is tremor of the hand, shaking, very, uh, high frequency shaking of the hand. Uh, those are the signs. Tremor, okay, of the hand. And also hyposecretion, prolonged hyposecretion may lead to clinical conditions or diseases. One is called myxedema. Myxedema is a condition in which the face of the person will look edematous. That means fluid has accumulated under the skin. That's why it is called myxedema. And particularly under the eye, the area under the eye will become puffy, swelling, uh, like hanging, bagginess. We say bagginess of the eye. So that is myxedema. And goiter is a clinical condition in which you will see the person's thyroid gland is enlarged. Since the thyroid hormone cannot be produced, you remember I talked about the follicles filled with colloid, and where you have the tyrosine, that amino acid essential for T3 and T4 production. So if the person's thyroid gland, the follicles are not producing thyroid hormones T3 and T4, what will happen? The tyrosine, that protein, will start to accumulate since they are not being used. So tyrosine molecules will start to build up or accumulate inside the follicles. Now when all the follicles inside the thyroid gland will get bigger because of more protein inside, the size of the thyroid gland will enlarge, and that is called goiter. Okay, it happens in young kids very often in those countries where the kids don't get enough iodine rich food. That will cause decreased production of T3 and T4, so the protein will start to build up or accumulate. Okay. The parathyroid hormone, or PTH, which is also called parathormone, it increases the calcium by three ways. Uh, Parathyroid hormone stimulates the osteoclasts. You remember, one type of bone cells, and osteoclasts break the matrix. You remember, break the matrix of the bone, and the matrix contains a lot of calcium, right? The main mineral is the calcium. So the calcium will be released into the blood. So the blood calcium will go up. So from the bone matrix, calcium will be released, and that calcium will enter into the blood, so that will increase the blood calcium. So this is one way, acting on the bones. In the on the kidneys, parathyroid hormone will increase reabsorption. That means what? uh, Reabsorption means taking back into the body, returning into the body. Okay, returning into the body from the kidney. So now, since parathyroid hormone increases the calcium, it will do what? It will tell the kidneys to return the calcium into the body. Reabsorption of calcium. So the calcium will go back into the body, will not get out through the urine. Okay, so that is another way the calcium in the blood or in the body will go up. And calcitonin also works on the intestinal mucosa, on the intestine. And it will do what? It will uh, increase the synthesis of vitamin D. So vitamin D helps in the absorption of calcium from the food we eat. So vitamin D increases absorption of calcium from the food we eat. So You see here, the parathyroid hormone will increase the production of vitamin D. Vitamin D works on the intestinal mucosa, and from the food we eat, the calcium will be absorbed more. So the blood calcium will go up. So parathyroid hormone works on three structures: bones, stimulate the osteoclasts, kidneys to retain or return the calcium back into the body, reabsorption, and on the intestinal mucosa via vitamin D production. Okay, so that's how the parathyroid hormone increases the blood calcium. Very important hormone. You see, this is the back of the thyroid. These are the parathyroid glands, 4 to 18 numbers, and works on the bones, kidneys, intestine. Hyperparathyroidism, just think that if the parathyroid hormone secretion occurs more in hyperparathyroidism, then what will happen? The matrix will be destroyed more, right? So the bones will get soft and deformation of the bone will occur. Okay, will get very weak because matrix gives the hardness of the bone. We know that. Okay, and increased calcium will depress the nervous system. Okay, that may lead to the control function of the body down, because nervous system is the main control system, right? So the regulatory functions will be low or less. And increased calcium also may lead to kidney stones, because we know that calcium molecules, they tend to accumulate somewhere and form calcification, stone formation. Okay, so that will also that may also happen. So increased parathyroid hormone will increase the calcium in the blood and will cause the kidney stone formation and depress the nervous system. Okay, now the concentration of calcium concentration is very important. In your blood, calcium concentration must be between 9 and 11, 9 to 11 milligram per 100 milliliter of blood, or per deciliter of blood. Okay, this is very important that your body keeps the calcium concentration within this range. If it is below 9, less than 9, that will cause hypocalcemia. Hypocalcemia. If it is more than 11, hypercalcemia. Both are bad. Okay, hypercalcemia. Both are not good. Both are bad. So hypofunction or hyperfunction or hyperparathyroidism, both are um, not good. They can cause some severe consequences. If the calcium concentration is low in hypocalcemia, if it is less than 9, hypocalcemia may cause tetany, convulsion, paralysis of the respiratory muscles, and may even cause death. So you see that parathyroid hormone is very important. Adrenal gland. You must remember I mentioned few important functions of the adrenal gland in the first slide, and I also mentioned that adrenal gland sits on the kidney. The outer part is the cortex, inner part is the medulla. So in the cortex you have 3 layers. How many? 3 in the cortex, and 3 layers act as 3 separate glands because they produce totally 3 different types of hormones. So these 3 layers produce 3 different types of hormones. So this part is the cortex. We say three glands, three glands within one, and this is the medulla, inner part. Okay, so adrenal cortex has three layers, produce three different types of hormones. Okay, and medulla produces another chemicals. So we'll talk about those. Three layers of the cortex are zona glomerulosa, and the hormones produced by this layer is the outermost layer called mineralocorticoids, and the middle layer is zona fasciculata. The hormones are called glucocorticoids. Okay, and the innermost is zona reticularis. Produce this layer produces sex hormones. Mineralocorticoids regulate minerals. So regulate minerals. Name is telling you. Okay, sodium, potassium, calcium. Those are the minerals, and the most important mineralocorticoid hormone is called aldosterone. Okay, it regulates the sodium. Works on the kidneys. Glucocorticoids from the middle layer. Glucocorticoids. uh, the most important one is called cortisol. Cortisol. It increases the blood glucose, number one. Number two, it has a strong anti-inflammatory action. Cortisol is used as medicine. Its name is hydrocortisone. Hydro. I'm sure some of you have heard this name when you go to buy the ointment or the drop uh, to reduce the inflammation of your eye or skin. Hydrocortisone 2%, 1% is strong enough to reduce the inflammation. So hydrocortisone. So that's the most important hormone of zona fasciculata, and reticularis produces sex hormones. So those are three layers in the cortex. So here you see zona fasciculata, zona glomerulosa, the outermost, fasciculata middle, reticularis innermost. Then the medulla, the inner part is the medulla, and the medulla produces two very important chemicals, adrenaline and noradrenaline. Similar action. They activate the sympathetic system, nervous system. Sympathetic nervous system, and just know that these hormones are responsible for fight or flight. Fight or flight response. Okay, and what kind of changes occur in the body. The heart rate will go up if when your sympathetic activation occurs. For example, you see something is scary, sympathetic activation occurs. You are watching a movie, has a lot of suspense drama, sympathetic activation occurs, so your heart rate will increase, you will get excited, your blood pressure will go up, muscle tone will increase, right? So those are the actions of adrenaline, noradrenaline. Sometimes you'll see on the box of DVD it says that when you get the DVD, this movie has a lot of suspense or drama, will increase your adrenaline pump, right? That means will increase your adrenaline release in the body to cause those changes. So that's the adrenal gland. Okay. Now the hypersecretion of adrenal cortex and hyposecretion, more secretion will cause, that is called hypersecretion, increase secretion from the cortex, adrenal cortex. That will lead to a clinical condition that is called Cushing's syndrome. Hypersecretion, Cushing's syndrome. Three important changes I'll mention occurs in Cushing's syndrome. One is a lot of fat, a thick pad of fat accumulates, form, or a lot of fats accumulate in the back of the neck and the shoulder, and that is called buffalo hump. A lot of pigmentation of the skin, and also acne. On the skin. And another change is moon face. The person's face will look like more round, moon face, okay, because of fat accumulation. So those are three common signs of Cushing syndrome that occurs due to hypersecretion of adrenal cortex, from the adrenal cortex, glucocorticoids. Less secretion or hyposecretion may lead to a clinical condition that is called Addison's disease. Okay, so in Addison's disease, we see a number of symptoms, including fatigue, fatigueness, weight loss, okay, hypotension, low blood pressure. Now, this type of hypotension occurs in Addison's disease, that is called postural hypotension or orthostatic hypotension. That means when the person changes the posture from lying to sitting or sitting to standing, suddenly the blood pressure drops. Okay, so postural hypotension. Okay, cramping of the abdomen, abdominal pain, disorders of gastrointestinal system or GI, gastrointestinal disorder. Okay, so these are some symptoms of Addison's disease. Night sweating, another one. Okay, last thing, ovaries are female gonads, testes are male gonads, and production of sex hormone is the function. In case of female, estrogen, progesterone; in case of male, testosterone. The sex hormones help in the growth of reproductive organs, reproductive organs, maturation of sperm or ovum. Okay, another function. So growth of the reproductive organs in the body, maturation of sperm and ovum during production of sperm and ovum, then sexual behavior, desire and drive. Okay, and the last one, secondary sex characters. These are the characters that separates a male and a female externally. So you know which features separate a male and female. What are the male secondary sex characteristics? Facial hair, loud voice, right? Deep voice, Adam's apple, more skeletal muscles, prominence of skeletal muscles, broader shoulders, baldness. So those are given by the male sex hormone testosterone. Okay, and female secondary sex characteristics include the broader hip, right? Female breast, then subcutaneous fat under the skin, more fat accumulates, voice, high pitch, voice. So those are the female secondary sex characteristics. Okay, so those are the functions of the sex hormones, and they come from the gonads, testes, and ovaries. Okay.